Hey everybody, a really happy Friday to you in St. Louis. If you are watching us, it is the first really nice day we've had in a long time. And we're in an office. I'm here with Dr. Cynthia Rogers, who is joining us on From Belly to Baby this week. My name is Abby. I have been doing this, we were just talking about it, since week 13 or 14, I think, of my pregnancy, and I'm now at 37. So I'm not going to do the math. That adds up to 20-something maybe. I don't know. It's not as easy to calculate as the sale price of a Kate Spade purse, but we are at the point that we're now talking postpartum issues, which is so crazy. But one of the most common topics that comes up about postpartum is postpartum depression, the baby blues, those kinds of things. So throughout the next several minutes, we're going to be talking to Dr. Rogers about postpartum depression and the baby blues, and we welcome your questions as well. So feel free to type those in the comments, and we'll get to as many as we can live. And if we don't get to them live, we'll do our best to circle back and review those later and get back to you with answers. So we'll start with thank you so much for joining us.
Thank you for having me.
Tell us a little bit about who you are, what you do, and why you became a psychiatrist who is interested in helping moms who struggle with these issues.
So I am both a child psychiatrist and I do perinatal psychiatry, working with pregnant and postpartum moms. And really the interest in helping moms stemmed from my work with children. So it's really difficult to help children if you have a mom or caregiver that's struggling. So it became apparent that if I really wanted to make an impact in how children develop, that I needed to work with parents and with moms specifically. So I initially started working with moms and dads from the neonatal intensive care unit at Children's, because it's a really high-risk population because of the stress that they're going through. And then over time, I joined with another pediatrician who was interested in helping moms of full-term babies, and we formed a service dedicated to treating pregnant and postpartum moms here at the medical center.
Well, and now you see parents on all ends of the spectrum. You said the NICU, so just to give you some indication of where we are, the NICU is the Newborn Intensive Care Unit at St. Louis Children's Hospital. This is all part of the Women and Infants program. That is a collaboration among Barnes Jewish Hospital, St. Louis Children's Hospital, and Washington University School of Medicine, and we're all here on the campus right off Kings Highway. So you see these patients, so mom delivers a baby at Barnes Jewish, or in many cases outside in the community. Baby winds up here. And then at what point does your interaction take place with the parent?
So our service includes social workers, coordinators, therapists, psychologists, and psychiatrists. And so initially in the neonatal intensive care unit, our coordinators meet the parents, check in with everybody, because an important component of what we do is provide education even to moms that are not suffering. And then when we screen moms with a measure we use to assess their level of depression, those moms that are having significant symptoms either get referred to see a therapist, or if their symptoms are very severe, get referred to see a psychiatrist.
And how do you know, and we can talk about it in the clinical setting that you see in the NICU, but more generally, I think the biggest question is, how do you know? I mean, the very basis of it, what is postpartum depression versus what are the baby blues?
So the baby blues are commonly experienced by women a few days after having a baby. You might have some periods of sadness that seem to come out of the blue, or crying spells, but it resolves on its own and it's very brief. Postpartum depression is a brain disorder, and it involves significant impairment to the mom. So periods of sadness, and even more than that, just not enjoying things that you would normally enjoy, including being with your baby, having difficulty sleeping, having no appetite, trouble concentrating, feeling very fatigued. At its worst, these feelings of worthlessness or hopelessness, and even at times thoughts of wanting to die or wanting to kill yourself. Some moms experience intrusive thoughts of wanting to hurt their baby. They don't want to hurt their baby, but they have these scenes or images that pop into their mind that they might hurt their baby, that are very scary for them.
And is it something that you would recognize in yourself, or is it something, I mean, I think back, and it's not comparable, but it's the closest example I can come up with, to the first trimester. And I was talking to someone the other day, and I was like, the worst problem I had was in the first trimester. I was a hot mess. I cried for no reason, and all of these things, but I didn't know that until I felt normal again. I didn't realize that it was strange.
Yeah.
So can you recognize that in yourself, or is it something that you really need to rely on other people to identify?
It's a little bit of both. I mean, certainly some moms report that they didn't know how bad it was for a long time. until a partner or a family member pointed it out to them. And I think it's sometimes easier for our family members and support system to notice it in us before we notice it in ourselves, because it's a big behavioral change. You know, that suddenly you're not smiling, you're not happy, you're not laughing, you're not sleeping, you're irritable, you're crying all the time. But I do have some moms who report, you know, they noticed it, and they noticed it pretty quickly, but they were too scared or ashamed to admit it to anybody because they thought it meant they were a bad mother, because here's this new baby that they're supposed to be joyful about, but instead they're sad and down and you know, just not enjoying anything. So I think it's a little bit of both. But I think one of the important reasons we want family members to be able to notice it is not only because the mom doesn't notice it, but because there's so much shame that they may not report it to anybody.
Well, I think that's the thing too, and it goes back also to that conversation we were having, I think in the very first episode of this series, where we talked about how you never want to seem ungrateful, because there are so many people who struggle, and so many people who would give anything to be in the position you're in when you've got this perfect new baby. But you say this isn't an uncommon issue at the same time. How often does it occur? Do you have, I mean, I don't even know if it's a statistical thing or if you just can say anecdotally, it happens a lot.
It's very common. So women who have the full-blown disorder, it occurs about 10 to 15%. So we're talking 1 in 8 women. And I've had many family members, personal friends who've reported to me that they suffered with postpartum depression. It's more common than other complications of pregnancy. So we spend a lot of time, you know, telling women about preeclampsia or gestational diabetes or these other, you know, potential risk factors. And at the end of the day, a lot of these mental health issues like depression, anxiety that are related to pregnancy are more common. And unfortunately, suicide has a higher morbidity. You know, more women die from suicide related to pregnancy than from these other complications.
Really? Oh my gosh, that is a statistic I had never heard. And it's something we've talked about birth plans and how I think society sort of has ingrained in us that we can plan so much of this. But it seems like, and this was one of my colleagues the other day, said it always amazed me that planning stopped at the delivery room, because that's the point at which someone sends you home with a new person who's going to live under your roof for a good long while, and it doesn't come with an instruction manual or anything of that nature, and you have a massive life adjustment. So is there anything people can do, women, families can do in preparation for the, so it's, I think, do they call it the 4th trimester, or is that just, okay, so the 4th trimester is what time frame? About,
I don't know when they say it ends, but they're basically just talking about that postpartum period,
Gotcha.
the early postpartum period.
Is there anything you can do to prepare yourself for it?
I think education. So that's one of the reasons our service starts with pregnant women. So we're now in our pregnancy clinics here at the medical center providing education about depression during pregnancy and afterward to a lot of women, so that you know that it's common, what the signs are, what the symptoms are. So when they start, you can be aware and get help sooner, rather than have to wait till you've been suffering for months before you realize what's going on, or someone in your family realizes what's going on, and you seek help.
When you talk about seeking help, do you have to look for a specialist, or do you talk to your pediatrician, to your OB? Who do you reach out to for that kind of support?
All of those are perfect. So our obstetrician partners are very good now at assessing this and screening for it and treating it. And so I would say for most women, you know, we all, even when we're not pregnant, our OB tends to be our main physician. So we have good relationships with them. So I think that that's a good first step for a lot of women. The pediatricians are also now screening for postpartum depression. The American Academy of Pediatrics has really recommended that be a part of all the well baby visits. So pediatricians are becoming more aware of it too. They're sort of your first step. If I think at a point where they feel they're not comfortable in treating the symptoms that a woman is having, they will refer out to a psychiatrist or a psychologist or another mental health clinician. If you already have an established relationship with a mental health clinician, that's also a good place to start. And then we're here, we take a lot of referrals from the community as well. So, you know, if there's no one that you know to talk to, or we don't know where to find help, you know, we get a lot of calls from women who realize that they're suffering and they don't know what to do and they don't know who to turn to, and we assist them both with referrals to us and referrals from the community.
And we'll be sure to put what contact information you have for this program in the comment section of this broadcast right after we're finished, so keep an eye out for that. And is there any determination of, can you say, okay, so I wake up in week 1 and just feel miserable, but it's diagnosed early. First of all, how is it diagnosed, and how do you treat it?
So like most mental health disorders, it's diagnosed from symptom report and from the observation of the clinician. So really it's the mom's, saying, I'm not sleeping, I'm not eating, nothing makes me happy, I'm having difficulty concentrating, sort of all those symptoms that we discussed before. And so sometimes we have screening measures, questionnaires that we have the moms fill out. Otherwise, sometimes it's just asking the question. The obstetricians are pretty good at diagnosing it, and then mental health clinicians are all well versed in diagnosing it. This is not necessarily anything that's different than depression at other points in life either. In terms of, you said treatment. So for mild depression, where you're having the symptoms but it's not super impairing, psychotherapy really is the best first treatment. When it becomes, the symptoms become so severe that you can't take care of yourself, you can't take care of your baby, or you're having thoughts about wanting to die or wanting to kill yourself, that's when medication really becomes necessary. And so the combination of both therapy and medication has been proven to be most effective.
So I think anybody who was around, I don't know how long ago it was, maybe 10 years ago, the whole Tom Cruise, Brooke Shields conversation, we'll call it, regarding where, the question of how safe for intelligent use of these meds came up. Is use of the medication safe while you're caring for and potentially nursing a baby?
So the studies that we have to date show that the most common medicines that we use, the most common antidepressants we use, are fairly safe. There's no medicine that has no risk. I will say that a lot of women who are pregnant and postpartum are on a lot of other medications too that also potentially carry risk, like antihypertensive medicines or medicines for diabetes or insulin. So it's not that these medicines have been proven to be any less safe than other medications. The evidence so far points to the fact that depression itself is dangerous to the mother and to the baby, both during pregnancy and in the postpartum period. And so you have to weigh the risks and benefits with each individual mom, whether or not medication is the best option. So we can't say the medicines have no risk, but having depression also doesn't have, it comes with risk as well. Yeah. So that's why you can't just say, well, the medicine has a risk, so I'm just not going to treat someone, because when you don't treat someone, then you're leaving them with the risk of the disorder. And it's not just suicide, but during pregnancy, it's been associated with preterm birth and other obstetric complications, lack of prenatal care, other things that are also detrimental to the mom and to the baby.
Well, it's kind of just that on a much simpler level. I talked about, there was someone who, I was buying a soda in a gas station months ago, but I was clearly showing I was pregnant, and the person behind me said, "Are you sure that's a good idea?" And I was so tired, and I had another hour and a half to drive, and I said, it's got to be better than falling asleep on the road. Right. And so, I think it's just a matter of really having a clinician that you can talk to and understand what the risks are, and know that, not doing something can be every bit as harmful as, or more harmful than doing something.
Exactly. And that's why, the American Congress of Obstetricians and Gynecologists have come out in favor of, if you have, significant depression, using medications during pregnancy and the postpartum period, when it's necessary. And the other thing to keep in mind is it's not a one-time decision. It's not like you've decided I'm going to go on medicine, and then if something if you decide later to stop, that you have to continue. This is an ongoing conversation that you should be having with your clinician about risks and benefits and how you feel about it at any given time. I will say, though, that for women who've been treated successfully on medicines, abruptly stopping your medication because you got pregnant is associated with relapses in your disorder. So that's something else. That's why it's really helpful if you have a prior history, which is kind of the number one risk for postpartum depression, to talk with your clinician about what you should or shouldn't do if you become pregnant.
I think that's my next question about risk factors. Are there any people who are more predisposed or who should be more on the lookout than others?
Yes. So those that have had a prior history of depression or anxiety, or strong family history, are at greater risk. Those who have other stressors in their life, like a lot of, say, marital stressors or financial stress, are at greater risk. Those who have high-risk pregnancies medically, are at greater risk. And then if, in terms of the postpartum period, if you have an infant in the neonatal intensive care unit, you're at higher risk. And if you don't have a lot of support, so, you don't have a supportive partner or a lot of family around who's giving you a lot of support during pregnancy or the postpartum period, that also puts you at greater risk.
And once the diagnosis has occurred and you've initiated treatment, can you set a clock? I mean, is there any amount of time that someone can think, okay, I mean, like right now, I'm 3 weeks at max away from a cure to heartburn. Okay, so do you have a point at which you can say it's going to be 3 weeks or it's going to be 2 weeks? Do you have a countdown, or is it
You mean in terms of being risk-free?
Or no, I'm sorry. If once you've been diagnosed with postpartum depression, can you say it's only temporary, it will end by X date?
Unfortunately, no. So each individual person's length of an episode is different. How quickly treatments work for individuals are different. So we can't say, I'm going to treat you today, and then it's not like a course of antibiotics where you get 14 days and then you're cured, unfortunately.
And do you have instances where the depression maybe initiates during pregnancy? I had a friend who would describe some of the things you were talking about. Like it was, in her words, she said, I just felt like if something happened to me, it wouldn't hurt. Like, I mean, it wouldn't be a big deal. It wouldn't matter. And she said, and it didn't occur to me until much later that wasn't healthy. It just was, but she was pregnant when that started. And so is that something that is correlated with postpartum depression, or does it usually subside at some point and then?
So, yeah, depression during pregnancy is one of the major risk factors for postpartum depression. And for a long time, depression during pregnancy was going under-recognized. I think people now are becoming aware that it really is as common to have depression during pregnancy as it is during the postpartum period, and can be very detrimental to the mom's health and to the baby's development. And so we're definitely trying to more actively engage clinicians to educate moms during pregnancy and to screen during pregnancy. And now most obstetricians do screen for depression during pregnancy.
And why is that? Why does it occur?
So that's an area of active research. There are some people who believe it's hormonally related, others who believe that, it has a lot to do just with an individual's brain and in a time of acute stress or change. So unfortunately at this point we don't know exactly what the impetus is to this time period having depression. I should say it's not more common to have depression during pregnancy and the postpartum period than during other times of life for women. So it's not like this is a heightened time. The risk is pretty much the same throughout, but it just seems to be a time when it's obviously more harmful to experience it.
And is there anything before you go down the road of medicine, say perhaps initially it is just the baby blues. I mean, it is just that hormonal swing that you experience after pregnancy. Do things like exercise and diet influence those lifestyle choices? Do they influence your ability to bounce back mentally, or is it, if it's going to happen, it's going to happen? If it's going to develop into postpartum depression, that's going to happen?
There's been some research showing that exercise can be helpful in terms of shortening episodes, decreasing symptoms. So I definitely think that exercise is something people can with their obstetrician's approval, safely engage in. I mean, that's true throughout life, that exercise can be very beneficial for mood. So that's something that we definitely recommend. I'm a big fan of yoga because of the deep breathing. If you can't get the positions, that's fine. But really from the deep breathing aspect, especially because one thing we haven't discussed is that a lot of women experience not only depression, but also a significant amount of anxiety during the postpartum period, either with or without depression. And I find that yoga can be really helpful for that too. So,
and what's the difference between depression and anxiety?
So depression was sort of all those symptoms we talked about, the sadness, the not enjoying things, the difficulty sleeping, feeling worthless, hopeless. Anxiety is really worry, but taken to the nth degree, right? So you can get these recurrent thoughts that just won't stop. And so postpartum OCD is something that we see quite a bit, obsessive compulsive disorder. Or just, panic attacks, like where your heart's racing, you're short of breath, you feel like you can't breathe or feel like you might die, that occur just out of the blue all of a sudden. Or just excessive worry that's, really out of proportion, where you're worrying about, your safety, your husband's safety. This could go wrong, that could go wrong. And then you might get some physical symptoms like muscle tension, headaches, things like that.
That's really interesting. I know someone else anecdotally was talking about the anxiety issue, and she said it's so hard to recognize because you think so much of that is just, well, I have a person I'm taking care of now who's relying on me for everything, so of course I'm going to worry. But she said it took me a while to realize that worrying and strategizing how I would deal with people coming into my home and taking my baby and obsessing over it was not normal. And it took someone else recognizing it. So if you had advice for support people, for partners, for family, whoever is helping a mom in those first couple of weeks, what would it be?
It would be, let her get some rest, you know, and tell her that she's doing a great job and that she, you know, is doing the best that she can. Because I think a lot of it comes from perfectionistic, I'm not doing this right. The other thing if you can help her get some sleep, like we know that lack of sleep is really a risk factor. And so those early days, it's tough, obviously, because the babies don't sleep very much and you're feeding constantly. But that level of support, someone who can come do the cooking, someone who can come do the laundry, someone who can, you know, just to decrease the amount of stress that the woman is under. We know that's not possible for everybody, but for those who have people in their lives who can do that for them, that can be very helpful. And to not be overly critical. You know, I know we all sort of have been in situations where everyone wants to tell you how to parent your baby. So, but
it starts really early too, by the way.
So to have people in your life who are being supportive of you, taking some of the load off, helping you get some sleep when you can, those sorts of things can be really helpful.
I'm sure, the sleep deprivation can't help. I mean, it's just I believe we were talking about breastfeeding in the last episode, and they were talking about it's every 2 to 3 hours, and you're not supposed to pump until about 3 weeks in now, is the recommendation. And I mean, yeah, exactly. That's what I said. And to have that all be on one person, because you can't give up a nighttime feeding, I mean, if that's the way you're going about it. So it is, I think, pretty important, that whole sleep when the baby sleeps thing.
It sounds ideal, but it's very difficult.
How do you do it? I was going to say, I don't know how anybody makes that happen.
Yeah.
But any other advice that you would offer, anything we haven't covered?
I would just say, you know, for women to, as best they can, educate themselves, educate their partners and the other people in their family so they know what this is. So they know that if it starts, that it doesn't mean they're a bad mother, they're not going crazy, that it's, you know, a common complication of pregnancy. And to, you know, as best that you can, have ideas, as you said, to plan for the postpartum period to reduce your stress and figure out, you know, who can help you with cooking, who can help you with other things, so that it's going to be a stressful period anyway. It's a big change in your life. You know, huge role transition for especially for first-time moms, or even if you have other kids at home, and to just be gentle with yourself. Like, you're learning something new, you're doing your best to take care of this new baby, and to not be, you know, don't have that harsh critic in your head telling yourself that you're doing things wrong, because those are all things that, you know, we commonly hear in women who end up having significant depression.
And I'm sure, and I've talked about this in the past, that I think the hardest thing about pregnancy is the lack of control you have over even your body, your life, everything. And that grows exponentially when you have a baby. So I think just adjusting to that reality is a hard thing for many women, and I can see how it would affect many in a significant way.
Yeah, I think if your expectations are, I'm going to be a perfect mom, and I'm going to do everything perfectly by all the books and all the things online say to do it, I'm going to do exactly like that, and I'm also going to still, you know, do all the other things that I always did beforehand in the first, you know, 2 or 3 months of the baby's life. You're setting yourself up for you know, a lot of stress, unnecessary stress. And instead, if you can say, this is going to be a challenge, it's going to be hard, and I'm going to do the best I can, and, you know, as long as I'm feeding this baby and baby's you know, growing and alive, like, I've done a great job. You know, I think that that's something that we can help a lot of moms with.
That darn internet. I mean, on Facebook, everything looks so perfect in everyone's lives, but people only post the happy pictures.
That's right.
Darn it.
That's right.
Well, thank you so much for joining us. We really appreciate it. It's, again, a really important topic, and we'll put those resources in the comment section of this post after I get back to my office. And next week we'll be back to talk another postpartum discussion about what happens to your body after the baby is born. And I got to tell you, a little nervous about that one. And no one tells you. So we'll look forward to seeing you next Friday, 1 o'clock. Until then, have a wonderful weekend. Enjoy this beautiful, beautiful weather.